today's slide deck. All attendees have been muted upon entry. We are pleased to have a large group of attendees who have registered. So to ensure good audio, please remain muted throughout. We encourage your participation by using the WebEx chat feature. You can feel free to ask questions and make comments throughout the presentation. We definitely want to hear from you. Once our presenters are finished with their segment, they'll be responding to your questions through the chat feature. But if we don't get to answer all of them via chat, Tracy is going to bring them up towards the end of the webinar when we have scheduled time for Q&A. I also want to point out that the WebEx chat is located on the right-hand side of your screen, so be sure to notice the drop-down menu with options for who can view your message. As always, I like to provide a little bit of background before we get started, background on MiHIN, that is. We are a network for sharing health information statewide for Michigan. Our mission is to continuously improve healthcare quality, efficiency, and patient safety by promoting secure electronic exchange of health information. Our success comes from 5 focus areas. So we convene people, our stakeholders, to listen, learn, and get feedback on our functional solutions. We partner with our stakeholders and champion statewide use cases or data sharing scenarios that get various types of healthcare data flowing from providers to the health information network, and then out to all parties who have active care relationships with patients. We operate the shared services among the participants in the health information network. That includes the behind the scenes infrastructure for network participants to easily share information across the state. We provide tools such as My Gateway, Viper, direct secure messaging, and the Referrals Plus application, which you're going to hear more about today, as well as various other tools to support daily workflow and coordination. And finally, we provide reports, conformance standards for data and analytics from data lakes and the longitudinal record. So here's our agenda for today. First up, I'm going to share some information about the Referrals Plus application. It's our solution and for making referrals and really what to expect in an upcoming upgrade this month. Then Shreya Patel, MiHIN's Chief Policy and Privacy Officer, is going to go over a guide created by MiHIN's COP Task Force. It's intended to help our network participants prepare for CMS's conditions of participation requirements for ADT messages. Then we're going to have some announcements and then of course time for Q&A. So please, again, be sure to send your questions in throughout the presentations via the chat feature. So with that, I'm going to get started telling you a little bit about Referrals Plus solution and our upcoming upgrade this month. For those of you who aren't already familiar with Referrals Plus, this is a tool that MiHIN offers in order to support the bidirectional electronic referrals that you may make to specialists as a primary care. You may make referrals to specialists, or you may make referrals to community-based organizations. It really helps medical providers as well as community-based or social care organizations coordinate care and ensure safe and timely services for patients who are in need of medical referrals or, again, community or social care referrals. The network of Referrals Plus participants or organizations is actually the largest closed loop referral network in the country. And it's made up of over 1,100 organizations statewide. So here you're seeing a visual of our user interface. It's modeled very similar to an email account with options to organize referrals on the left-hand side and to share important information between sending and receiving organizations. It tracks referrals and helps close the referral feedback loop. And of course, that helps to ensure that patients' needs are met. It does have a two-way chat feature that allows for real-time communication between a sending organization and a receiving organization. And every stage of the referral is documented, which helps provide transparency and easy workflow. Another very nice feature is that it has a searchable provider directory. So if you're looking for a community resource or a specialist in your area, you can potentially find one by searching that directory within the tool. There are a lot of other really great features that I'm not going to get into today because we just don't have time. But ultimately, it is a very great, efficient, effective tool for ensuring your patients receive the care that they need. So this month, we're excited to be adding some new administrative features around reporting capabilities. The primary new feature is an interactive reporting module that can help administrators identify opportunities to improve coordination for care for patients. And with the reporting module, specifically referral administrators can review current and historic trends for referral volume by both the organization and specialty. You can analyze referral completion, the status and appointment. If there have been any delays, you can kind of analyze and trend if there have been delays in the time that a referral is moved across the referral lifeline. You can review referral trends by patient demographics, and you can even drill down to see provider level referral details. So if a provider is sending a lot of referrals to, say, a cardiologist or to a food shelter or a food center, you can see how many referrals are being sent out on any given time period. So the next steps for the upgrade include we are developing a user guide for the new reporting module, and we will send that out to the current participants. We plan to offer a webinar demo opportunity for current participants or current users, I should say, to participate and learn about the reporting functionality. Our goal is to send out the new download, which will automatically upgrade your solution by 4/20. So keep your eyes open if you are using the tool currently and you're a referrals administrator. Keep your eye open for an email that's going to tell you about when to specifically expect the download file to upgrade the tool. If you are an organization that is on the server portion of the, or the server, the server portion of the application, then you've already received communication and we'll be communicating with you separately. If you have questions or need assistance regarding the upgrade specifically, please submit those to help@mihin.org, or you can call the phone number that's listed here. You can also submit a ticket via our self-service portal, which is available. You can get that link as part of the interface newsletter that was mailed out to you this morning. If you want to learn more about the referrals application and the features and how it can help your office with efficiency and with taking care of your patients, you can reach out to one of our executive or senior regional account executives. We have Stephanie Miller on the west side of the state, Brian Bullock in central Michigan, and Greg Kavanaugh in eastern Michigan. Their phone numbers and email addresses are listed, so if you want to quickly jot those down. And then also, if you are part of a health plan or an enterprise organization, here are our corporate account executives that you can reach out to. We've got Kim Batchelder, who serves the state of Michigan, Katie Olds, who serves Michigan Medicine, Bo Bernacki, who serves Blue Cross Blue Shield, Megan Gibbs, serving Ascension, McLaren, Munson, and Trinity, and then Matt Stromer, serving Medicaid health plans. So with that, I'm going to turn it over to Shreya Patel. She, like I mentioned, is going to provide an overview of MiHIN's guide to conditions of participation compliance. Shreya, are you there?
Katrina, this is Tracy. I'm actually not seeing Shreya in. I don't know if she's having technical difficulties logging in, so I'm working through that now.
Okay. All right. Well, while we wait for Shreya, I'm going to go ahead and move on to some other announcements that we have for today. Our first virtual event kicked off on March 23rd for Connecting Michigan to Health and More. We have a range of topics that are planned throughout the remainder of 2021. As we continue to explore the new standard of healthcare, we're calling it Healthcare 3.0 and its implications for ongoing evolution of healthcare delivery, experience, costs, and outcomes. We welcome you to join us. We have a few more virtual events, 4 more virtual events coming up. And they're outlined, the dates are outlined here. You can go to our website to register for any of those events. One really exciting one coming up is the Social Determinants of Health workshop, which is actually this Thursday. There's still time to register. So again, you can go to our website to register, or if you receive the interface, MiHIN's monthly newsletter, you can register there. There's a link there to register as well. I also want to introduce and welcome Kate LeBeau to the MiHIN family. Kate joins MiHIN as our community organizer for MiHIN's advanced care planning program called Making Choices Michigan. She's going to be really focused on growing our advanced care planning network needs. She comes with a ton of experience. She holds a BS from Northern Michigan University, an RN from Bay College, and her focus has been in palliative care and other end-of-life issues. We're so pleased to have Kate on our team and helping to advance our mission to build community champions for advanced care planning statewide. If you have any questions about Making Choices Michigan or want to learn more about being a champion in your community for advanced care planning, you can feel free to email Kate. Her email address is listed on the screen. All right, so that is my portion of the presentation today. So I'm wondering if Shreya has joined yet.
Katrina, she has not. I'm not sure what the issue with login is. Still working on figuring that out, but maybe we could move to any questions that the group might have regarding the referral upgrade.
Yeah. I haven't seen any chat questions come in, so if there are any chats or questions about Referrals Plus, if you want to send those via chat, or you can also raise your hand and we'll unmute you. Well, while we wait for Shreya, I guess I'll ask some questions. Is there anybody on the call who's currently using the Referrals Plus application? Would you like to come unmuted and make a testimonial? I'm thinking like Shreya will join, so I just don't want to keep everybody on hold, but I also don't want to let everybody go so early.
Yeah, again, apologies. I'm not sure if there's a technical issue on her end. We did have one question that came in though about how an organization gets added to the Referrals Plus network.
Yeah, so great question. Thank you for asking. To join the network, you simply should reach out to one of the account executives that we have listed here. If you're not part of one of those enterprise organizations that I mentioned, these account executives handle, reach out to Stephanie in West Michigan, Brian in Central Michigan, or Greg Kavanaugh in Eastern Michigan. And they will give you details on how you can become part of the network. It's a really rather simple process once you are part of the HIN legal framework, the Health Information Network legal framework. It's just a matter of downloading a desktop application. It's a very simple download file, and it takes about 3 minutes to download. And you are, if you're a primary care office, you're really set up automatically. If you're a specialty office and you wanted to create a customized questionnaire so that you can get all of those questions that you need answered about a patient answered right up front, it would just be a matter of spending about 15 to 20 minutes creating that questionnaire within the application, and then you just set it as live and you are up on the network. We will make an announcement that you have joined the network through our monthly newsletter, and then you'll just be asked to check the application on a daily basis, several times throughout the day, to ensure that you're seeing any referrals that have come into your organization. Again, if you're a sending organization, you'll get a list, or you can search all of the organizations or the specialties that you could potentially refer to. So with that, I see another question. I am new to Michigan. Are there any parts of Wisconsin included in the Referrals Plus application? We are in the UP near the Wisconsin border. That is a great question. At this time, there are no parts of the Wisconsin using the application. However, that does not mean that it's not a possibility. If you're interested in growing a network in your area or receiving referrals from the part of the UP that you're close to, that's certainly a possibility, and we can talk about that, or you can have a conversation with one of our account executives about that. So with that, we are not going to waste any more of your time today as it relates to the COP conditions of participation. We know that it's a very, very important topic, and compliance is required in the next couple of months. And so we will not hold up your time anymore, but we will make accommodations to send out a very detailed guide on that the MiHIN, like I mentioned, the MiHIN task force for COP has created. It's a detailed guide on how to ensure your organization complies with the CMS measures that have been set forth. So with that, thank you all for attending today. And unless there are any other questions, we welcome you to attend our next download, which is on May 4th. We'll be sure to have a full 45 minutes of content to share with everybody at that time. Thank you all for joining. See you next time.
Thanks, Katrina. Thank you all. Have a great day.